The Innovac2 from Innovative Medical Technologies has revolutionized capillary sampling with vacuum-assisted collection. The quick draw adapter fits your current capillary collection container so that it can be used with the Innovac vacuum unit. The adapter contains a capillary straw that is internally coated with anticoagulant to allow the blood sample to come into immediate contact with the anticoagulant, eliminating one of the major causes of clotting. This is especially helpful with slow bleeders. The quick draw adapter also contains a primary vent filter that prevents blood and airborne particles from escaping the collection vial. A secondary hydrophobic disc filter is in place on the vacuum unit to prevent any blood from entering the unit should the primary filter fail. You should check the cleanliness of the disc filter before use. If it is contaminated, then you'll need to replace it before proceeding. The Innovac2 operates on a standard 9-volt battery and is easily installed. The on-off button is on the top of the unit and has a red low battery indicator light. The extension tubing set attaches to the disc filter. The quick draw adapters attach to your current capillary collection vials for plasma, whole blood, and serum samples. Be sure the adapter is pressed completely onto the container. If it is not, you may experience less than optimum vacuum during collection. Assemble all of the collection vials you will need for this draw. Now, attach the quick draw assembly to the extension set and you're ready to use the Innovac2. Use your normal skin puncture technique and with the unit on, apply the tip of the quick draw assembly, as shown, to the puncture site. The vacuum action draws the sample into the collection vial. This eliminates the need to scoop, which causes hemolysis, and less squeezing is needed because the vacuum will collect even the smallest drops. You don't need a large hanging drop. During collection, air being pulled through the vial causes the sample to mix automatically with the anticoagulant in the vial. This eliminates the need to stop and tap and mix the sample during collection. This automatic mixing leads to fewer clots, less hemolysis, and fewer re-sticks for your patients. You can check the volume of sample collected by momentarily disconnecting the tubing from the adapter. This allows the samples to settle so you can see the volume of sample collected. Simply reattach the tubing to collect more sample. To collect another sample, simply remove the quick draw assembly you've just filled from the tubing and attach the second quick draw assembly to the tubing. After collection, remove the quick draw adapter and discard in a biohazard waste container. There will always be a small amount of sample in the capillary straw. Disregard this, as it is a very small amount that is difficult to remove. Cap the collection vial with its original cap, mix well, and process according to your facility's standard procedure. The extension tubing is designed for single patient use, and for settings where this is not practical, another option is the extension tubing sheath. The sheath economically protects the extension tubing from contamination while collecting your samples. The sheath is disposed of between patients. Simply feed the extension tubing under the white tab and through the sheath. Remove the top portion with the blue tab in the direction shown. Then, holding the tubing end protruding from the end of the sheath, peel the paper backing in the direction shown. Attach the tubing to the quick draw assembly. Now the tubing is protected from contamination during sampling. After each use, discard the sheath safely. The Innovac2 can be cleaned and disinfected by wiping the unit down using your standard disinfecting procedure. A disinfecting wipe works well for this.